Welcome back. During hospice care, the medical team will walk you through treatment options and at some point have what's called an end-of-life discussion. Dr. Sarah Whelan, a hospice and outpatient palliative care physician with OSF HealthCare, joins us today to tell us what this looks like. Good morning.
Good morning.
So first, whose responsibility is it when it comes to having this discussion?
Well, I think a lot of that responsibility falls with the physician or provider. It's not an easy conversation to have, but the physician's job is to take that initiative to start the conversation. Patients don't often want to face the question of what's your end of your life like and what's it going to look like, and so it's important for the physician to initiate that conversation and then guide the patient and the family through that conversation to really identify the patient's goals and wishes for the end of their life and to find out what they value.
What strategies are used to ensure effective communication with patients who may be facing end of life?
Sure, there's a lot of strategies, and I think each provider might have a slightly different approach, but one thing I think it's important to start out with is making sure the patient is able to engage in the conversation. So making sure they're well rested, their pain is under control if possible, we minimize distractions. And then often I have the kind of nice part about my job is I do a lot of these conversations in the home, so that allows patients to naturally feel more comfortable. And then often I'll ask the patient permission to have kind of a difficult conversation so that I know how to best care for them going forward. Then I'll find out a little bit about what they understand of their illness, what their treatment has been, and then sometimes we even go as far as asking what they'd like their final days to look like, or even where they'd like to be when they do pass away. I think all this really helps to shape the treatment plan so we as a hospice and palliative care team know how best to care for the patient.
Another term we're hearing, and maybe some people don't know more about it, is palliative care. Can you describe this for us?
Sure. Palliative care is care for patients who have chronic illnesses that are rather advanced. Often, well, really at this point, the treatment has shifted from curative treatment to more symptom management or improving quality of life while trying to keep them out of the hospital, trying to minimize all of those frequent hospitalizations and ER visits. So patients will have easier access, kind of a bridge to that care, so we can try to keep them treated quickly. Palliative care isn't just for people that are at the end of life, it's really for people with chronic symptoms and all with that goal of improving quality of life.
So what is OSF's hospice philosophy?
Sure. OSF hospice philosophy is really to care for the terminally ill patient and their families in the comfort of their own home. OSF hospice care allows patients to live their final days of life surrounded by the people and the things that they love as comfortable and pain-free as possible.
That's very beautiful, and I know it's probably not something that's easy to do, but thank you all for the work that you do.
Thank you.
We'll be right back, and we'll also have all of this information on our website, 25newsnow.com.